Assalamualaikum and salam sejahtera to our Madam Puan Norima binti Said and our fellow friends. Today, our group will present the group assignment. First, let me introduce our group members. Nur Atika binti Ibrahim, Nur Azila binti Abdul Rahman, Nur Hanisa binti Isamuddin, and my name is Manzal binti Ismail. Our group topic is Growth and Development Infant 1 and 3 months. Okay, and the topic will be covered. First, what is growth? Second, what is development? Third, principle of growth and development. Fourth, factor influencing growth and development. And the last one, growth monitoring for infant 1 and 3 months. Include assessment of growth and assessment of development. What is growth? It is the process of physical maturation resulting in an increase in size of the body and various organs. It occurs by multiplication of cells and an increase in intracellular substance. It is quantitative changes of the body such as weight, height, head circumference and chest. So maksudnya kat sini, dia dianggap sebagai quantitative changes of the body kerana growth ni dia boleh diukur melalui kiraan ataupun nombor lah. Contoh seperti berat badan, ketinggian, ukur lilit kepala dan juga ukur lilit dada. Next, what is development? It is the process of functional and physiological maturation of the individual. It is progressive increase in skill and capacity to function. It is related to maturation and myelination of the nervous system. It includes psychological, emotional, and social changes. It is qualitative aspect such as breathing and walking. Okay, benda ni kita tak boleh kira macam growth tadi, tapi kita boleh pantau perkembangan seorang kanak-kanak itu melalui perbuatan dia lah, seperti membaca ataupun berjalan. Okay, next, principle of growth and development divided by 3. First, cephalocaudal directional. Second, proximedistal directional. And the third one, general to specific. First, cephalocaudal direction is the process of cephalocaudal direction from head down to tail. This means that improvement in structure and function come first in the head region, followed by the arms and then leg. Okay, maksudnya kat sini proses perkembangan bayi tu dia akan mula daripada atas dululah, dia akan daripada kepala dulu, lepas tu dia akan kepada tangan and kemudian baru ke kaki lah. So tak ada bayi ataupun seorang tu proses dia start daripada kaki dulu ataupun tangan dulu. Maksudnya dia akan start daripada kepala juga dulu. Proximal direction, the process from center or midline to peripheral direction. Development begins from spinal cord followed by the outer parts of the body. The sequence from arms to hands and legs followed by fingers and toes. Okay, and the last one, general to specific. Children use their cognitive and language skills to reason and solve problems. Children at first are able to hold the big things by using both arms. In the next part, able to hold things in a single hand. Then only able to pick small objects like peas, cereal, and so on. And the last one, children when able to hold pencils, first he will start draw circles, then squares, then only letters, after that the words. So maksudnya kat sini, perkembangan seseorang bayi tu dia pun daripada yang senang dulu dan kemudian baru yang susah. So contohnya macam dia pegang pensil, dia akan start daripada yang senang macam melukis bulatan. Lepas tu dia akan buat petak, kemudian dia akan tulis satu patah perkataan dan kemudian baru dia akan bentuk kepada satu ayat yang lengkap. Okay? Okay, next I will pass to our group members to present the factor influencing growth and development. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. I am Hanisa binti Isamuddin. Would like to present my part, which is factor factor influencing growth and development for the infant age 0 months to 3 months years old. Next. Okay. The first factor that we can see here is a genetic factor. Genetic factor is a genetic predisposition, is the important factors which influence the growth and development of the children or of the infants. Example, Down syndrome, disease of the Down syndrome. Second factor is we can see is a prenatal factor. Prenatal factor refers to maternal condition such as undernutrition and anemia are associated with intrauterine growth retardation. It means the mother that in pregnancy, which is malnutrition, or maybe she's developed anemia during pregnancy, she can develop a factor that the baby inside the womb maybe can be retarded or maybe can malnourished because of the maternal mother itself, which is malnutrition, not get enough nutrition, balanced diet, example. Second one is obstetric conditions such as pregnancy-induced hypertension, preeclampsia, also cause growth retardation. Likewise, chronic medical disease like chronic kidney failure, coronary heart failure also cause fetal growth retardation. Drug intake in the first trimester may cause congenital defects to the baby. Maternal infection like rubella, syphilis, cytomegalovirus infection may be transmitted to the fetus and may cause retardation to the fetus. As we can see here, the mother that have underlying disease or comorbid disease such as kidney disease may got the factor to the fetus from the womb itself to be retarded. Also, if the maternal mothers take some drugs or alcohol, example is alcoholic mothers, the mother itself take drugs, it may affect to the fetus inside the womb, and the baby itself can be retarded or delay in developmental growth. Okay, the third factor is the postnatal factor. The postnatal factor such as growth potential, nutrition. As we can see here, nutrition is being described as the maternal mother itself. If she get good nutrition, the baby itself can be a normal fit baby during delivery and may not have a retarded growth. Third one is childhood illness. Okay, the factors such as childhood illness. Example, if the pregnant mother got asthma, example, she can the baby inside the womb can inherit her mother disease that afterwards the baby when delivery, the baby also can immunocompromised like being allergic to the dust, asthma like her mother, and so on. Physical environment, psychological environment, cultural influence, socio-economic status, climate and season, play and exercise. Play and exercise here is I can see from the pregnancy itself, the mother can interact with the baby inside the womb, interacting, because the baby inside, the fetus inside can hear her mother and can recognize her mother's voice, and from there the baby brain and nervous system it stimulates the baby nervous system, and the growth cannot lessly retarded. Birth order of the child, intelligence and hormonal influence. Okay, as you can see here, this is the book that we use, KKM use at KKIA, which is Maternal Child Health. The blue one is the Rekod Kesihatan Bayi dan Kanak-kanak 0 to 6 years old. This is for boy, blue one, and then The pink one is the rekod kesihatan bayi dan kanak-kanak 0 to 6 years old. This is pink is of course to the girl lah, female child. And then this is the flow chart on infant checkup at klinik kesihatan in Malaysia. Okay, this is actually the same schedule for infant checkup on 3 months. The difference is the point on the checklist here. Okay, for 3 months baby, usually the baby's head is quite strong. They are not. We can see the kepala dia dah tegak lah, straight lah. Bayi menumpukan pandangan dan menggerakkan mata mengikut objek. Okay, the bayi have response. Bayi can laughing when we agak-agak dia. The baby can laughing and reflects to the voice, to the environment. And then if there are any abnormalities, the nurse should refer it to the doctor for assessment. Okay, this is as a visual anthropometry checkup assessment. Okay, next. So that's it. Okay, so that's all for my presentation. Thank you.
Assalamualaikum. My name is Marzia Binti Abdul. We will proceed with group and development monitoring for infant age 1 month to 3 months. This is the assessment of growth for infant age 1 month and also 3 months. We measure their body weight, their height and also length, their body mass index, their hip circumference, their frontal enclosure, chest circumference, and also mid upper arm circumference. Usually we will measure their left upper arm, and the normal range for infant is 9 to 11 centimeter. For body weight is the best criteria for assessment of growth and good indicator of health and nutritional status of child. For full terms only, their normal body weight is approximately 2.5 kg to 3.5 kilograms. There is about 10% loss of weight for the first week of life, which regains by 10 days of age. This is the normal weight gain during 1 to 6 months. The baby will gain about 2 times from their birth weight for 7 to 12 months, 3 times of their birth weight, 2 years old, 4 times of their birth weight, and 6 years old, 6 times of their birth weight. This is the chart to show the body weight for boys and also for girls. In 1 month old, the body weight is in between 3.4 to 5.7 kilograms for boys, 3.2 kilograms to 5.4 kilograms for girls, and in 3 months old, 5.1 kilograms to 7.9 kilograms for boys, 4 to 4.6 kilograms to 7.4 kilograms for girls. This is how we measure the infant's body. What is length? Length is a measurement taken when infant lying in common position. It is taken from crown of the head to the heel, usually used for children below 2 years old. Height. Height is a measurement when the child is standing upright. So we are taking their height when they are able to stand on their own. Stunting or slowing in growth may not be observed in less than 6 months. By first year, height will increase by 30 centimeters, which is 50% of their birth height. This is the chart for baby length. 1 month old. The baby length for boys is approximately 54.7 centimeters and 53.7 centimeters for girls in 3 months old, about 61.4 centimeters for boys and 59.8 centimeters for girls. BMI. Body mass index is an important criteria which help to assess normal growth or inflammation, which is malnutrition or obesity. We can detect this condition using BMI. BMI content up to the age of 5 years old. If BMI is more than 30 kg per meter square, it is indicate obesity. But if the BMI is less than 50 kg per meter square, it is indicate malnutrition. Head circumference. It is related to brain growth and the development of intracranial body. Average head circumference measure about 25 cm at birth. At 3 months, it is about 40 centimeters. If head circumference increase more than 1 centimeters in 2 weeks during the first 3 months of age, then hydrocephalus should be suspected in the infant. Head circumference is measured by ordinal tap, placing it over the occipital protuberance at the back, above the ear on the side, and just over the supraorbital range in front, the measuring point of head circumference, like this. So we can take it the infant head circumference. This is the head circumference for the average in 1 month. The baby will have 38.1 head circumference for baby boy and 6.4 for baby girls in 3 months old. The average for boy is 41 centimeters and for girl is 40.1 centimeters. For chest circumference, normal chest circumference range from 50.5 to 52 centimeters. Usually, the chest circumference less than centimeter the circumference. The chest circumference is measured at the level of the nipple using a tape measure. A chest circumference less than 50 centimeters indicate prematurity, and enlarged heart may make the left side of the chest larger than the right side. That is for me. We continue with our friends, Ma'idah. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Atika binti Abdul Rahim. So today I will representing the assessments of a development. Assessments of a development consists of 5, which is gross motor, fine motor, personal and social, language and visions and learning. Gross motor development of newborn, primitive reflex can be divided into 6 categories, which is sucking and eating. The descriptions of this sucking and eating: when you touch baby lips, cheeks, or the corner of the finger, will turn the direction of stimulation and open the mouth to suck. Swallowing, when feeding, swallowing reflex occur after sucking without a cough. Grabs or plumber and planter. When placing finger in baby's palm, their finger will grasp around while their toe will curl downwards. Extrusions: when touch tip of a baby's tongue with a spatula, the baby tongue will protrude. Moro: when holding baby and start straddling them, they will abduct and extend their arms symmetrically, leg responsibly. This is commonly happen to the baby newborn till 1 month. Next, development milestone for baby 3 month age. For the gross motor, most likely baby will put their hand together at the midline body. I follow the moving object. So when baby start to reach 3 years old, we usually will observe on their gross motor by observing how they react with the interactions of the object. By language and speech hearing, making, cooing, and swelling sounds respond to the rattle sound. For example, somehow you can see most of the baby tend to have the interest to talk with you. So that is the development they are reaching for language and speech. Psychosocial, smile spontaneously and interest in the surrounding. When it comes to age of 2 to 3 months, this baby tends to have the interest smiling on the person that doing something towards them. So this is a psychosocial motor. Connective, when regards the faces, most of the baby in the early ages of their development, they tends to recognize their mother and father for 3 months. Then when they're reaching to 4 months and above, they start to recognize and comfortable with the people that they always see. Next, I will be demonstrating the anthropometry for baby 3 months.
Contoh demonstrasi pada hari ini akan saya tunjukkan adalah menggunakan bayi lelaki. Ini adalah contoh buku rekod kesihatan bayi dan kanak-kanak lelaki. Pemeriksaan pada bayi umur 3 bulan merangkumi tarikh rawatan, umur semasa rawatan, berat, panjang, BMI, lilit kepala bayi, pemeriksaan fizikal termasuk mulut, tindak balas, jaundice, penilaian penyesuaian, imunisasi, merujuk pada jadual dan rekod imunisasi yang terkini. Temujanji akan diberikan di akhir klinik. Catatan dan tanda tangan jururawat yang bertugas diperlukan. Perkara yang membimbangkan ibu bapa juga harus direkodkan oleh jururawat. Memeriksa keadaan perkembangan bayi. Sekiranya mempunyai perbezaan daripada yang sepatutnya, jururawat hendaklah merujuk kepada doktor. Panjang bayi haruslah diukur daripada hujung kepala sehinggalah hujung tumit kaki. Hujung tumit kaki bayi, pastikan kaki bayi dalam keadaan yang lurus. Okey, hujung. Dan kita dapat 64 cm. Proses menimbang berat bayi. Pemeriksaan anthropometri kepada bayi merangkumi ukur lilit kepala bayi. Ukuran harus diukur daripada atas cuping telinga dengan bacaan sentimeter 42. Selepas itu, ukur lilit dada. Ukuran haruslah dilakukan di bawah ketiak bayi mengelilingi puting 41 cm. Okay.
This is a reference that we use for our presentation. Thank you.